Okay, so I'm going to be demonstrating a shave biopsy. This is a pig's foot here, and we've got this blue macular lesion that we're going to be performing shave biopsy technique on. First thing we're going to do after getting consent from the patient, getting a photograph of the lesion, is we're going to go ahead and clean the area with some rubbing alcohol. I'm using just aseptic technique for this, generally kind of a clean procedure. From this point, we would go ahead and mark the lesion. It's typical with anesthesia that it's going to distort the skin surface a little bit, so I usually kind of go ahead and mark whatever I'm going after prior to anesthesia. We're going to be using buffered lidocaine with epinephrine. I kind of like bevel up, so if we look very closely here at the needle, the bevel is up. And we're going to go in at about a 45-degree angle. So kind of giving some tension to the skin. I'm kind of going at about 45 degrees. We're going to inject just at the border of the lesion. And we're going to kind of start to push the drug in there. This has a little bit more resistance than human skin does. But we're basically watching for a little wheal to kind of come up here. Maybe some orange peel change in the skin, which we'll see more classically on thicker skin like that of the back than what we'll see kind of elsewhere. And sort of as a courtesy to your patients, when you have to add more numbing, which I'm going to do here, if you can go through a spot that's already anesthetized, just a good clinical pearl. Okay, and you'll feel kind of a level of induration that'll happen with that. We're going to be using just a basic surgical blade. I like this because it gives me a lot of flexibility to get into nook and crannies, and you can kind of sharpen the blade edge based on how much you're bending. Again, just kind of applying tension to the lesion. I get kind of a running start, and the concept is I'm staying in the same plane as the lesion itself. No melon ball scooping action, just plane of the skin. If this winds up being a benign lesion, I'd like to have as minimal scarring left behind as the patient goes through this procedure. So we're going to kind of start running. Saucerization technique, as we've kind of described in the lecture. We're going to be having a little bit of epidermis, or all of the epidermis rather, and a little bit of the dermis. So you wind up with something like this. And ultimately this would be then put into a pathology bottle and sent off. You can kind of see that we have just the slightest little indentation centrally there. And generally speaking, when we're going after a pigmented lesion, as this one was, we want to kind of encompass the entire border. From this point forward, we would do some basic wound care. We use aluminum chloride. And we can basically kind of envision that we'd be kind of doing some hemostasis this way, cautery if necessary, and then application of ointment and a bandage. That's the concept of shave biopsy.